𝗙𝗰𝗲 and welcome to Face to Face. I am 𝗙𝗰𝗲-𝗁 and today with me we have one of the renowned psychiatrists in Bhutan. That's right, Dr. Nirola. To discuss a topic that is usually untalked about, especially during pandemic. And as we all know that mental health includes our emotional, psychological and social well-being. It affects how we talk, how we feel and how we act. Mental health is very important at every stage of our life, from childhood, adolescence, through adulthood. Many factors contribute to mental health problems, and we have Dr. Nirola with us to talk about. As we all know that the lockdown just opened and the atmosphere right now is quite a tense one. So people are confused that they might contract the virus other than just following the COVID-19 protocol. How can we calm ourselves? What would be helpful advice during this time?
Okay, basically now the country has relaxed all the protocols. Now the reason why it has been done that way is basically now the common variant that is going on is Omicron, and they have found out that it's a very mild version, and then it does not really make people very sick unless they have a comorbid conditions. Of course, people with very serious medical conditions and all have died in the past, and we have seen that it was not really related to COVID as such, even though they tested positive, but there could have been other conditions that must have taken their life. So if we actually look at this coronavirus thing, it's like any other flu, except that it was a very fast acting, plus it affected people very severely. Now whoever is testing positive these days just had very mild symptoms actually, so which means that I think all of us might get infected. So in order to prevent that, we must use all the practices that we have in place, like using mask, washing your hands frequently, doing all the tracing and all. Now besides that, I think it is no point worrying about something, because many times what we do is we don't live now. We live in a world of fantasy, in the sense that what if I get this disease, what will happen? So if we start worrying, what happens is actually stress is a very bad thing for our body. Stress decreases your immunity. So if your immunity goes down, the chances of getting more severe infection is likely. So therefore, we must remain calm. Okay. So at the moment, I think people should now think that even if we get it, it will be like flu only. And if it becomes serious, already there are indications that you'll be taken care of. You can go to the hospital. If you need oxygen, they'll provide that and all. So I think instead of worrying, we must prepare ourselves so that we don't get sort of. If you get an infection, you should not get alarmed. So that is very important. So people must do that. So basically, not worrying about what is going to happen, living a very healthy life, taking exercises, not drinking too much of alcohol or substances, and then not, at the moment, I think we should not have too much of gatherings and all. I think all these things can actually prevent us from this. So along with our physical condition, we should also be able to use our mental faculty to make ourselves strong and build our immunity so that we can fight with this infection even if it comes.
If someone already has a pre-existing mental health condition, how can we protect or promote their mental well-being?
Seek counseling services that we have. Now we have opened the hospital, so we have adequate number of counselors who can provide treatment, who can provide therapy, and the medications definitely have to be continued. They should not stop their medications.
So regarding counselings, are they trained or?
Yeah, our counselors are all clinical counselors who have had 4 years of degree from the Faculty of Nursing and Public Health of JDWNRH. So they are all qualified people. So what we do is, like as psychiatrists, we evaluate them, and then since we don't have adequate time to to sit with one individual for a long time, we assign them to different counselors, and the counselors give them appointments, and then they see them from time to time, and they also teach some relaxation techniques so that they go back home and practice. But the problem is many of our people, even when we give them some sort of activities to do at home, people really don't take that seriously because they want everything to be fixed by somebody, which cannot happen. So as a patient with any type of mental disorder, I think it is not only the doctors and counselors who have to fix them, but you must try and fix yourself also. So there has to be a partnership between the therapist and the patient so that you reap the benefit of the treatment.
Doctor, the teleconsultation includes your number too. So what was the most interesting case that you dealt with now?
Oh, interestingly, during the lockdowns, I was every day answering to people who were panicking. So one thing is, I think we are not used to living inside the house for a long time. We are a very gregarious and social people who want to go out, meet relatives, have dinners together and all that thing. I think when we are deprived of that, we get suffocated inside the house. So that actually led many people to have panic attacks. In fact, we had a sort of a pandemic of panic attacks as well when COVID was going on.
Mental health problems are common, but help is available. People with mental health problems can get better and many recover completely. We just have to learn how to talk about our mental health and how to get help for ourselves and for those who we care about. Thank you so much, Doctor, for your time, and thank you to the viewers for watching us, and we'll see you next episode. Do follow us on Facebook, Twitter, Instagram, and YouTube. Thank you so much.